Today we're living in an increasingly challenging world. Conflicts and crises are being felt everywhere, whether in countries at war, places where climate change is causing catastrophic natural disasters, or communities living in areas stricken by poverty and lack of access to basic human needs, including healthcare. Any of these situations mean that inevitably it is those most vulnerable, namely women and girls, who are worst affected, and where the issue of gender equity can often be a matter of life and death. So I am here today to stress to you the importance and imperative of eye health, which on the face of it, when so much strain is being felt in so many ways, may seem a little odd. But I assure you, when we get it right with eye health, it has an incredible, life-changing, far-reaching positive impact beyond the act of saving or restoring sight, which is why I am passionate about it and why it is so deserving of our action and attention. As Global Ambassador for the International Association of the Prevention of Blindness, I have been championing the importance of vision for over 20 years. What I have seen in my time travelling the world is a shift in the understanding of those in decision-making positions in realising that eye health is not simply one health concern, but can be a proactive driver of development. The ability to see is directly linked to productivity and participation, impacting families, communities, and economies. If women and girls have access to proper eye care, they are not only more likely to secure better educational and career opportunities, as often the principal backbone of the family, they are then more able to juggle the many responsibilities a woman plays in the home, as well as contributing to community life. But more than that, we must let the money speak for itself. The loss every year to countries with large numbers of people in their populations with sight issues runs to the billions of dollars. Yet correcting refractive error alone in children could result in more than 50% increases in their lifetime earnings. In recent years, enormous progress has been made in addressing particular eye diseases, including the leading infectious cause of blindness, trachoma. We've worked with governments and organisations to create national strategies to tackle trachoma, which have resulted in a number of countries to be declared by the WHO as trachoma-free. Most recent countries to have achieved this status are Vanuatu and Vietnam, who join a number of others, including Pakistan, India, and Malawi. What has been interesting to see is how the use of technology to map trachoma, including the collection of gender disaggregated data, has enabled programs to be more targeted in their approach. And we now have confirmation that women are disproportionately affected by trachoma through gender issues, including high contact with children, repeated infections, low uptake, or access to services for women. In 2021, through targeted programs to reverse these norms, data revealed 60% of people who received surgical intervention were women in 30 countries that reported gender disaggregated data. While this data is encouraging, much more, though, needs to be done to achieve gender equity trachoma programs for women in statistically invisible populations, including nomadic, indigenous, and women of disability, requiring accessible and acceptable interventions. What we also know is that by tackling the issue of blinding trachoma, as well as other eye health issues within vulnerable communities, we are also positively impacting on other neglected tropical diseases. We are also aligning our priorities with broader health and development targets by prioritising eye health, working towards achieving the SDGs by 2030. However, what we all know is that there are growing challenges in the development sector. But we now find ourselves at a moment in time when universal eye health could be accessible to everyone globally. After the universal adoption of the UN resolution Vision for Everyone, the IAPB plans to create an opportunity for the world to come together for the first global summit for eye health. This summit will be an opportunity to amplify the urgency of addressing avoidable blindness and sight loss, catalysing national and global action on an unprecedented scale in order to shine a light on issues including the critical intersection of eye health, gender equality, and neglected tropical diseases. And I look forward to hearing how these plans are as they progress. With attention and resources being drawn elsewhere, we are conscious that efforts need to be redoubled in order that we don't lose this golden opportunity to develop this agenda and ensure women and girls' eye health remains a priority. Women and girls have the right to see and to be seen. By ensuring that they have no barriers through lack of access to basic eye health, we will be creating a more empowered future for all. I am hoping you are here because you know this is the right thing to do. And I thank you for your attention on this vital cause, which, unlike many complex challenges being discussed this week, is simple, impactful, cost-effective, and scalable. The task of tackling eye health is even more imperative now than ever before, and the need to work together all the more vital, because if we lose momentum now, we could face an almost impossible challenge. I ask of all of you, as I ask of myself, to work with us towards a brighter and more equitable future for everyone. Thank you.